Polypharmacy is a major concern in the geriatric population. Polypharmacy, which is the regular use of 5 medications or more, continues to increase. From 1999 to 2018, the percentage of geriatric patients who had polypharmacy increased from 23.5% to 44.1%. Even though these medications often are used to treat chronic conditions and increase life expectancy, use of 5 or more medications is linked to adverse effects such as falls or renal failure, drug interactions, hospitalizations, non-compliance with treatment, increased risk of disability, and cognitive decline. Wang et al. Even estimates that polypharmacy costs the healthcare system a minimum of $50 billion annually. As primary care providers, we need to make sure we're responsible for reviewing each medication, deciding if it is necessary and benefiting our patients, and educating patients and their caregivers on safe medication use and side effects to watch for. Interventions include regular medication reconciliations at each visit, being aware of which specialties follow and prescribe medications for our patients, simplifying their medication regimens, and including our patients' caregivers in education and monitoring. Deprescribing should be considered a therapeutic intervention as it works to decrease adverse outcomes through simplifying a patient's active medication list. Educating patients on deprescribing is also helpful so they understand the need to decrease the burden to assist patients in their understanding of polypharmacy's associated risk, as it is a collaborative effort. Our scenario starts with Mrs. Smith as she visited her primary care provider with her daughters to review her kidney function labs. Vital signs were within normal limits, except blood pressure was 100/60, heart sounds regular, and lungs were clear to auscultation. Amanda is the NP, LV is the MA, Abby is the patient, Hillary and Viri are her daughters.
Good morning, Mrs. Smith. How are you doing today?
I'm okay. Thanks for fitting me in your schedule today.
Of course, it's not a problem at all. Can I ask who you brought with you today and if you'd like them to stay in the room with us for your appointment?
Yes, these are my daughters, Hillary and Viri. They help me manage my medications and schedule, so I'd like them to know what's going on.
It's really nice to meet you both. Thanks for driving your mom in today.
Nice to meet you too. Thank you.
So, Mrs. Smith, what brings you in for this follow-up today? It looks like you have some question about your labs.
Yeah, that's right. I'm actually not feeling very well. My nephrologist said my kidney numbers aren't looking good, but I'm not sure why. I walk my daily laps around the facility. I stay hydrated. I eat healthier than I ever have. I guess it's just aging. It just happened so fast.
I'm really sorry to hear that you haven't been feeling well. I've actually been meaning to talk to you about your labs and have been trying to dig into why your kidney function is declining. I was looking over your medications. I noticed you're taking over 10 medications. And meds all have different interactions and side effects, and it can be really hard for our bodies as they get older to process these medications. Some of them can actually put stress on your liver and kidneys and cause your numbers to go down. Can you tell me how you manage your medication schedule each day?
Yes, it seems like all I do is take medications. I know I have high cholesterol, diabetes, and high blood pressure, and I know my thyroid is slow ever since I had it removed. But do I really need all these medications I'm taking? My daughters put my pills in my box for me. I just take whatever is in there, but it's confusing. Sometimes I forget to take them, so I just double up the next day so I don't miss any pills. It's just very confusing for me.
Yes, Mrs. Smith also mentioned during check-in that she sometimes skips her medications when she's feeling better.
Yes, what should we do about her skipping and doubling up on meds?
Our mom sometimes mixes up her morning and evening pills. I try to help her stay organized, but I'm not able to be there every day for her. And honestly, I'm not sure which medications are truly necessary and which ones aren't.
It's honestly overwhelming. She has three specialists prescribing medications, but it seems like no one's on the same page.
Very important that you take your medications as prescribed and don't double up if you've missed a dose. Are you able to use the alarm or reminders function on your phone to remind you when to take your pills? Can your daughters help you with that?
They're so good at those e-phones or whatever they call them. Yes, I'll have them help me set alarms so I don't forget any more doses.
Okay, sounds good. So unfortunately, this is more of a common issue than we'd like to see. So I'm glad you came in today. Not all offices have the same charting system, so it's really hard to get lists of medications accurate between all your specialists. And her medications should work for her, not against her. Okay, so first we'll make a list. Our list is completely up to date. And did you bring your pill bottles in with you? And is everything you're prescribed from everyone in this bag?
Yeah, this is it. It has the doctor's names on the bottles too, so we can see who's giving her what.
Okay, thank you. So it definitely looks like you're on some medications that can hurt your kidneys, and some you won't be able to take if your numbers get too low. For example, you're taking metformin, but if your GFR gets too low, which is one of your kidney numbers, we'd have to stop that medication. We're doing okay for now, but that's one we need to keep an eye on for sure. You're also on multiple blood pressure medications from two different doctors: lisinopril, hydrochlorothiazide, and amlodipine. You're also taking omeprazole, and this can also cause CKD in long-term use.
Oh, meprazole. I don't even know what that's for. Sometimes I get dizzy after taking those blood pressure medications when I stand up too quickly.
Omeprazole is for GERD or heartburn. Do you have heartburn? And what was her blood pressure today, LV?
Her blood pressure was 100/65.
No, I've never been told I have GERD. I complained about heartburn a while ago to my doctor last time I was in the hospital when I fell, but honestly, I found that cutting out coffee and tomato sauce has helped me feel much better.
Yeah, we remember her hospital doctor starting her on omeprazole. She must still be getting refills. It was only a couple of months ago.
Okay. Well, after looking at this list and based off of your blood pressure and lifestyle changes you've made to limit your heartburn, I think I have a plan. I'm going to take you off a couple medications. We'll see how your numbers look in a few weeks, okay? And I want to keep a close eye on you because if they get too low, we will have to stop your metformin.
Oh, thank you so much. I think it'll be much easier to manage with less pills.
You're welcome. I'm going to have her stop taking her omeprazole, her aspirin, her hydrochlorothiazide, and her ibuprofen if she can manage without it. Do you have any drug allergies? Can you take Tylenol for pain as needed?
Yeah, Tylenol works fine. Why am I stopping the aspirin though? Isn't that good to prevent heart problems and strokes? I don't want to get a stroke.
Yes, it is, but it can cause your kidney numbers to go down. And recent literature actually suggests that over age 60, taking it for prevention of cardiac events shows a little benefit.
Oh, okay, that makes sense. Well, I'm excited to stop taking a few of these pills.
I bet you are. You should hopefully feel a little better being off your hydrochlorothiazide. Our goal for your blood pressure is to be about 130/80. If it's too low, that could also be a reason why you haven't been feeling great. And I want you to let me know if your heartburn comes back or if your pain isn't controlled with Tylenol, okay? Here's your scheduled medications. Elby can get you some copies on the way out to bring to your specialist's next appointments, okay? Do you have any more questions for me, and are you happy with our plan?
This sounds like a great start. Thank you for helping our mom. I feel much better handling her medication schedule now that we've gone through everything with this again.
It's my pleasure. Please don't hesitate to call me if you feel worse over the next few days or if your blood pressure is above that 130/80 we discussed. LV can help schedule your next lab appointment on the way out so we can keep a good eye on your kidney numbers.
Thank you for your help. We'll see you in a couple weeks.
In this skit, we demonstrated the assessment and management of an older adult who is experiencing negative symptoms due to polypharmacy. This is a situation that occurs for a multitude of reasons, some of which we highlighted, including multiple comorbidities and multiple specialists prescribing medications. This skit highlighted the importance of taking a good medication reconciliation and involving our patients' family members with their care. It also demonstrated how we can simplify medication regimens and educate both our patients and their family members. This skit aligned with the National Organization of Nurse Practitioners faculty's core competencies of communicating effectively with individuals, engaging with the individual in establishing a caring relationship, and developed a plan of care. We applied evidence-based strategies to optimize safe medication use for our patient by cutting back her blood pressure medications and other potentially nephrotoxic meds such as aspirin and ibuprofen. We coordinated care among her caregivers and provided her an updated medication list to take to her specialist next time she has appointments with them. We also educated her daughters and included everyone in the decision-making process and agreed with the plan as a team. Safe medication management both improves clinical outcomes and enhances the quality of life of our geriatric patients while also reducing caregiver burden by simplifying their care.